Hi everybody, I'm going to talk to you about cysticercosis. Cysticercosis is an infection by larval cysts of the Taenia tapeworm. It infects muscles, brain, organs, and other tissue. And though many species can infect humans, Taenia uses humans as the definitive host. And so this is the tapeworm that is considered for cysticercosis. Neurocysticercosis is a more serious form of this disease, and it's actually a leading cause of adult onset epilepsy worldwide. This is where the cysts will infect the brain or spinal cord. This disease is caused by the ingestion of eggs from the T. solium tapeworm that are excreted from somebody who has a GI tapeworm infection. That's called taeniasis. Cysticercosis is classified as one of the 5 neglected parasitic infections by the CDC for the U.S. And though it's uncommon in the U.S., we do see it occasionally associated with food preparation by somebody who has taeniasis and does not properly wash their hands before preparing the food. So a little about the Taenia life cycle. The way this works is somebody who has a GI infection of a tapeworm will shed the eggs in their feces. An herbivore, and in this case a pig, which is used as the indefinite host of Taenia solium, will come along and eat some vegetation or something, and ingest the eggs that have been excreted by the definitive host, humans. And then those cysts travel to the tissue of the pig and just kind of lie dormant and wait to be eaten by a predator, a carnivore. So humans, when we eat the undercooked meat that has the cyst in it, we then can get a gastrointestinal tapeworm infection. However, if we ingest the eggs rather than the cyst, then we end up with cysticercosis. And with T. solium, it's often neurocysticercosis, as the cysts go to our brain often. Some of the symptoms. If you have cysticercosis in muscle, you can have anything from just small lumps or bumps under the skin, maybe a little bit of pain, but it's often asymptomatic. Neurocysticercosis, however, is much more severe. It ranges from having confusion, vertigo, edema, seizures, headaches, hydrocephaly, and even death. The way it's diagnosed is with imaging techniques, MRI, CT scans, and also blood tests where you're looking for antibodies against the T. solium species. You can also look at oral histories, whether an individual has traveled to an endemic region of the world, dietary habits, maybe they were drinking dirty water. You can also look at stool samples and see if they have taeniasis. You can count tapeworm eggs, see if there's evidence for that kind of infection, and that could suggest that there's a higher risk of auto-infecting yourself. There are various antihelmintic drugs that are used to treat cysticercosis. There's also surgery as an option if need be. And of course, some people who have cysts that do not have very many larval worms, and it's in an area where they don't really have any symptoms and the drugs are not getting to them, they often are just left untreated and just let go. Ways to prevent infection are frequent hand washing, especially before preparing food and after going to the bathroom, washing and peeling raw produce, and especially when traveling in countries that are endemic to T. solium, you want to avoid raw produce that cannot be washed and peeled, and avoid drinking dirty water. Only stick with bottled water or boiled water, not the tap, not ice cubes, that sort of thing. There are risk factors associated with an increased risk of contracting cysticercosis. If you live with somebody that has a GI infection of the tapeworm, you have a much higher risk of getting cysticercosis yourself. Also traveling, like we mentioned, to developing countries where there's poor sanitation, where you might be living in close proximity to free-ranging pigs, where those pigs can have access to ingesting human feces. Eating undercooked meat does not necessarily result in cysticercosis directly, but it can result in tyneasis, and then you can auto-infect yourself later with improper hand washing, for example. Some of the surveillance questions that I wanted to ask about cysticercosis were, what are the prevalencies worldwide and in the US of this disease? And are there differences in prevalencies in different parts of the world? What are the rates of cysticercosis? What are the dynamics of cysticercosis? Are those rates changing over time throughout the world? And are there differences in the prevalence of cysticercosis in sex, age, race, or other demographic factors? The first data source that I looked at to try to answer some of these questions was the CDC report on neglected parasitic infections in the US. This is a public health campaign that works with state and local health departments to try to reduce preventable causes of infectious epilepsy, to lower the economic expenditure on healthcare for treating cysticercosis and epilepsy, and to gather better information to advise healthcare professionals to be more savvy about diagnosis and treatment of cysticercosis infection. They also wanted to track patients of case studies closely to identify specific modes of infection, and also to assist local labs with diagnosis, and likewise develop novel and improved, more efficient diagnostic techniques. Some of the results from their study were that they determined that there were about 2,000 new cases per year in the US, and those cases were concentrated most heavily in Texas, New York, Illinois, Oregon, and California. They also determined that the average cost of hospitalization due to neurocysticercosis was over $37,000. Quite expensive for a preventable disease, I would say. Interestingly, they also noted that of those 2,000 new cases per year, most of them are occurring in immigrant populations and may be associated with imported food rather than endemic to the US. Some limitations of this study, however, were that it lacked a lot of detail on methods, and there was no data really presented. It was just a bunch of results, basically. I also looked at the World Health Organization report on neglected tropical diseases. They published first in 2009 and then 2013 as kind of a checkup on their first report. And the goal was to provide public health intervention and surveillance data on neglected tropical diseases throughout the world, cysticercosis being one of them. Up until this point, and still today, there's very little research that has been done whatsoever on the surveillance of this disease. They noted that more or less there are a few community-based surveys that have been done in places like sub-Saharan Africa. There's some case studies here and there, but very little national or regional support for anything more epidemiological in nature. Compiling all their data, they did find that there were some regions of the world that are much more at risk of cysticercosis, Latin America, sub-Saharan Africa, and Asia specifically. Some other results of their studies suggest they looked at community-based surveys in Africa, and they found that there was a much higher frequency in sub-Saharan Africa for cysticercosis compared to Muslim countries in Africa, which had a much lower prevalence. This is really fascinating, I think, because it shows that cultural and social norms do, in fact, impact disease risk and prevalence. They also found that cysticercosis, specifically neurocysticercosis, was greatly linked to epilepsy. Over 80% of the world's 50 million epilepsy cases were found to occur in areas where there is endemic tyneosolium infection. And 29% of the people that they looked at with epilepsy had neurocysticercosis. They also looked at many case studies case reports that suggested endemism in a lot of the Asian countries. And one really great meta-analysis that I found that they published from China that looked at cases over 7 decades found that there was cysticercosis cases reported in every province in China, and that 73% of cases occurred in individuals between 20 and 50 years of age. Not so surprising, that's the majority of most populations. The really interesting part was that they found a ratio of male to female cases of 2.4 to 1. That's pretty different, and it would be really interesting to see if this could be reproduced in other regions of the world. So looking back at my surveillance questions, I wanted to see which ones I was able to get data for or answers to, and which ones are left untouched. So I was able to find information on the prevalence of cysticercosis in the US and worldwide, and that there were some parts of the world that had much higher rates, sub-Saharan Africa, Latin America, Asia, for example. I was unable to find information on whether or not the dynamics of the prevalencies are changing throughout the world, because there's no real information about change over time in frequency. I was able to find a little bit of difference with regard to some of those demographic questions, like sex, for example. Recall the meta-analysis in China where the male to female ratio of cases was 2.4 to 1. Some limitations that I would like to talk about were that the CDC report, as I mentioned, lacked a lot of detail on data and methods. It was basically just a report of results. The World Health Organization report was a little better. It was a meta-analysis of a bunch of case studies and community-based surveys, but nothing novel. It was all things that have been done in the past. Some overall limitations to studying cysticercosis is that very little data exists to this point, and it was only recently prioritized. In fact, during the Obama administration is when it became prioritized for the states, and similar time frame for the World Health Organization. Also, many of the studies are case reports and community-based surveys. We really need more broad-scale epidemiological population-wide surveys. So some of the questions that are left unanswered, we still don't have much information about the dynamics of prevalence over time across populations. And we don't have enough information to detect heterogeneity among those demographic factors. Some of the next steps that should be taken, I think that we really need more large-scale epidemiological studies that can combine imaging techniques as well as antibody tests with veterinary and ecological data on the tapeworm, as well as behavioral surveys over a larger scale. So greater sample sizes, more data over greater amounts of time will be better able to answer some of those questions that are left unanswered. Also, I think we need to increase public awareness. Symptoms need to be better described to people so that they know what to look for. We can address public awareness for prevention, hand washing, for example, cleaning of fruit and vegetables, and drinking bottled and boiled water. Also, management of livestock. So evidence might suggest that penning pigs and keeping them away from human feces will greatly decrease the risk of cysticercosis infection. In conclusion, we know that cysticercosis is a preventable disease with known risk factors, and there's a high prevalence in the developing world compared to North America and Europe. In the US, it's often associated with immigrant populations rather than being autochthonous to the US. Now, the worldwide prevalence and linkage to epilepsy, as well as economic interests, medication for humans as well as livestock, culling of livestock, etc. These combined suggest a strong need for continued surveillance of this disease, as well as the development of more efficient diagnostic techniques. Thank you for listening to my presentation. I look forward to any questions.